It's a lot to come out to take time out, so I appreciate it. And good job, because you guys have already put an interest in your own health and putting energy back into you. So just by being here today, it shows that you care about your bodies and you care about your health and the rest of your life and the next steps and so forth and so forth. I just want to talk a little bit about the company. Integrative Health I founded in 2001, and I've been a part of this community since 2000. And so we've continued to grow over the years, and we keep adding more practitioners, different modalities of practitioners. We have a large group of alternative healthcare practitioners, as well as Western medical doctors, allopathic medicine. So I think it's important to, as a wellness center, to let you know that even though we really focus on healthcare prevention and look at nutrition and exercise and acupuncture and massage and chiropractic and things like that, that we really do care and respect about the allopathic side as well. So our first concern is our clients and our patients when they come in the door, that their best interests and safety is met. So having said that, we do recognize and respect, like I said, allopathic medicine. And let's face the facts. We know that we're limited on what we can do. If you come to an acupuncturist or chiropractic after your health has deteriorated so far, sometimes there's no turning back. So we recognize the need for surgery. We also recognize the need for, he's my little health problem, he's deteriorating. We also recognize the need for medications. There's a certain point to where, the process of disease has grabbed a hold and has been so rooted for so long that there is a place for medications. And we also recognize the fact that we love Western diagnostics. As a matter of fact, the majority of the people, at the time they've come to our clinic, they've been through the gamut. So usually people have already, whether it's irritable bowel syndrome or whatever their diagnosis was, they've usually been scoped and have gone through a lot of the diagnostics. So when they're coming to us, we usually have a lot of things to go off of. However, a lot of times people look at us like we are the ultimate cure at this point. And so we'll get into that about time and patience and the right fit. We also recognize that there are a lot of prescription drugs and a slippery slope once you start using medications. The average person probably uses 4 to 6 medications, and I've had people come in my clinic that have been on like 30 medications. So there's a lot of harmful side effects to medications, and so we always want to start with the least invasive first and see if we can correct the pathology and the disease process early on and using the least invasive approaches before you go down that cycle. A lot of times people are taking medications because of a side effect from another medication. And the death of prescription drug use is dramatically high in the United States. So it's a slippery slope. So if we can help prevent it or fix it before we get to that point, that's one of our objectives. We also recognize that there's extreme damage from surgeries. There's a lot of scar tissue that can cause worse problems in some cases than actually the problem we were in there for. We see a lot of people that have had lumbar surgeries, discectomies, fusions, cervical surgeries, things of that nature. And at one time, the American Medical Association made a statement that 80% of lumbar surgeries are unnecessary. Carpal tunnel syndrome at one point, and they're so much better now, had a high rate of it not actually curing or fixing the problem, because what would happen is you can get numb and tingling down the arms for many other problems. It can be your neck, it can be thoracic outlet syndrome, and it used to just be, carpal tunnel, you cut here, you do this, and then the pain's still there a couple months later. You can also run into a lot of problems between blood clots and swelling and nerve damage. So again, we want to start with the least invasive, and then rule out that as an option. If it's not going to get better, then you always have surgery later. Don't just jump right to a surgical procedure if there's a chance that it can be fixed. The other thing too is a shotgun diagnosis. So a lot of times, again, going back to the word fibromyalgia, we're going to irritable bowel syndrome. Those are broad categories that are a lot of times given medications, but they don't know why the problem is there, so how can you give a medication to actually work on the problem? A lot of times they'll use antidepressants to help resolve the stomach issue, which in some cases is beneficial, but it's just covering up the symptom and not fixing the core of the problem. So it's great when you have a physician or surgeon that can work together and appreciates both sides and says, hey, you know what, don't rule that out as an option. You had a knee replacement. I heard acupuncture is great for getting the swelling and inflammation down. And in some cases, in most cases, increasing the healing process by 3 times faster. So always look at those options, and again, we recognize and respect both. So the picture of health looks different to many people. We also really push and encourage a preventative approach. So nutrition, exercise, things like that are all mainstream. And so there's no denying that good nutrition can help prevent a lot of skin issues, even from eczema to psoriasis, to irritable bowel syndrome, to diabetes, weight loss. And exercise, yoga, and good mindset and stress, managing stress is so important. And if you don't make time for health, then you need to start making time for illness, because it's not a matter of if, it's a matter of when. And usually when all of a sudden something just happens, I woke up and all of a sudden my neck just hurt, I don't know what happened, it wasn't even an accident. Usually the problem's already been there, it's been compounded and building over a period of time. And so it's finally your body just can't take it anymore. There's a lot of signals that go on that we don't pay attention to because we're not as in tune with ourselves and our bodies as we should be. And so part of that is just learning and experiencing and getting educated and paying attention to your bodies. Some things seem normal and they really shouldn't be normal. We're just used to living with them. And so investigate those, and if you have questions, reach out to a healthcare professional, whether it's alternative or allopathic, and help dive in and kind of get into that for yourselves. But again, insomnia, weight gain, stress. I mean, stress is one of the huge silent killers of today. I mean, you get mass amounts of cortisol dumped into your body. It affects your digestive and your metabolism process. It affects your nervous system. And that's a trickle down to the disease process. The number one underlying part of the disease process is inflammation. So if you use that word inflammation and we start looking, what things create inflammation? More food, environmental toxins, gravity, we put under stress in our body, poor posture, sitting at the computer. All of those things, whether it's an internal inflammatory process in the bowel or in the spine, either way, it's inflammation. And after a while, the body has to start altering itself, whether it's a cell mutating or whether it's a bone spur growing around the ankle or bunion to help support your body, or a spur on the spine. Something is going to start developing or changing due to that inflammatory process. So there is no magic wand. We're all different, and each person has a different healing process, and will be unique. You should change the text a little bit.
Sorry, Ryan.
Okay. It'll take some time, patience, and work from you and your provider as a team to restore your health. And I wanted to put that out there because, again, a lot of times people come to us after they've been through the whole gamut. And there's a lot of expectation, like, oh, acupuncture, I heard it works. I've been through everybody else, and you're my only hope. And it takes time, and if it's acute versus chronic, what your ability is as far as to be able to do some homework that's given to you. And so there is still an active role from the practitioner and the client or patient to develop the teamwork and framework together to find out exactly what your needs are. And the quicker that is established in the first or second, third treatment, the better the long-term results will be. Some people come in and they just want to stay a little bit more passive, they want just a massage, and that's absolutely fine. Some people want to do a little bit more, take an active approach and start doing some of the exercises or dietary changes, and that's excellent too. But a marriage between the both, the work on the part of the client as well as the practitioner together can change things dramatically. And we don't want it to just change it for the short term, we want to look at the long term. Right? If something's been chronic, it's going to take a little bit more time, but ultimately we want you to be pain-free, or we want your digestive system to work again, or we want your sleep patterns to be restored again. 85% of the people that come into our clinic have insomnia, or restless leg syndrome, or something, sleep apnea, that's affecting their sleep, and a lot of those things can be changed. The earlier we get to them, of course, the better. So at Integrative Health, again, going back to we take the least invasive approach and natural approach, and we utilize things like massage and chiropractic. Chiropractic over here, you can see some x-rays, looking at some of the subluxations of the curvature of the spine to see how much pressure is on the nervous system and the discs. A deep tissue laser therapy, we have a cold laser and a hot laser that are magnificent for getting in there, especially for people who are afraid of the acupuncture needles. different styles of acupuncture and Chinese medicine that incorporates cupping, washa, herbology. And we're going to talk about these as we get moving through the circuit today. So we set up something a little bit more unique today to go through some of these details. Herbology. And now herbology comes in the form of a capsule, so it's concentrated, so we don't have to take nasty powders and things like that anymore. Yoga, exercise, and nutrition are all important things that we have in the clinic. And again, sometimes just coming in and finding out what the right fit is for you, what your needs are, and at what level you're at. So if we push too hard, it's not good for you or for us. We want to find out, do you want to be active? Do you want to take more of a passive approach? Do we need to start down here? When people come in, depending if it's chronic or acute, I like to use an example of a light switch dimmer. So eventually, we want to turn that light up bright. You want your health to be bright, happy, and restored. But we might have to turn it up really slow so we don't cause things to become aggravated as little as possible. Sometimes that's a natural roller coaster ride of getting better too, is when things are wound up, you have to kind of unwind the beginning and go back through that. So people who recognize alternative medicine, I used this on my last one just with acupuncture, but the National Institute of Health, American Medical Association, World Health Organization, and I couldn't find it, but again, I just want to talk about the Mayo Clinic because, and ask your physician this if they ever say this is just a good question for them. When there's really tough cases and people come in and we can't figure out, they've been through all the specialists and we just don't know what's going on, the number one place they like to send people to is the Mayo Clinic. The Mayo Clinic has one of the largest alternative health and medical departments there is. I have this magazine that was just put out by Time and co-authored by the Mayo Clinic. And if you go on the Mayo Clinic's website, you can see their acupuncturist, you can do all that. So it's interesting that they're at this high caliber over here, but they need to be trusted, that they appreciate and respect and have gone through the scientific evidence that all this other stuff works. So not only has chiropractic, acupuncture, massage, all these things becoming more mainstream and time-tested, they're recognized and they've had independent research by almost every major medical institution. And now even most of your major medical insurance will cover things like massage, acupuncture, and chiropractic. So there's just no refuting it. So we're going to take the first step today. I'm going to let every practitioner come up, give a quick introduction about who they are, what they do, and a little bit about that modality. And then what we're going to do is once everybody's done eating and things have kind of got their groove, we're going to allow people and help people go through like a little circuit. So you can have one-on-one, ask a practitioner a question about that modality and experience a little bit of it too. So in this corner we have deep tissue laser therapy, so you can feel what that feels like, whether it's on the wrist or your shoulder, a little sample today. I'm going to be doing Egoscue, which is postural alignment therapeutic exercises, so I'll do a quick evaluation with people and give an exercise recommendation, massage, and then chiropractic, and then acupuncture over here. So we'll go through the round. But again, we're going to take the first step. So if you schedule an appointment today before you leave, we'll cover half of the cost of your first appointment. I just wanted to say that and get it out there because a lot of times we get caught up in this circuit stuff. So I have two people helping me that are over here today. So they will be doing any questions and scheduling any consults or appointments today. So feel free to see them at any time.
Go.